Hello people, this is Dr. Muskaan this side, and today I'm going to take you towards a case which is of kidney disease. It is very interesting case and we are going to learn so many things together. So let's dive deep into this case and enjoy. Here is 58-year-old female, my dear friends, who has came to ER at 12:55 p.m. with chief complaints of fever with chills, shortness of breath and burning micturition since 10 days. So on arrival, ABCS was done, airway, breathing, circulation and sensorium. Airway was patent. There were no signs of airway obstruction. What are the signs of airway obstruction? Signs for airway obstruction are hoarseness of voice, choking, dysphonia, dysphagia. Patient is lying down and he's not able to breathe. Patient is walking, not able to breathe. Patient is holding his neck. सांस नहीं आ रहा, सांस नहीं आ रहा. So they do like this. So these are all signs of airway obstruction which are absent in this patient. That means airway is patent. अगर by chance patent नहीं होती तो क्या करते हैं, पेशेंट को इंट्यूबेट करते हैं इमरजेंसी वाले. ओके. On breathing assessment, respiratory rate was 18 per minute. SpO2 was 95% on room air. तो इसका मतलब कोई desaturation नहीं है, कोई bradypnea या tachypnea नहीं है. That means respiratory distress is absent. What are the signs of respiratory distress? It is abnormal breathing. What is abnormal breathing? It is either too fast, either too slow, either too shallow, either too deep. It is पेशेंट का जो फेस होता है इट बिकम साइनोज या फिर पेल, देयर कैन बी गैस्पिंग साउंड और गर्गलिंग साउंड. ओके, सो दीज ऑल आर साइंस ऑफ रेस्पिरेटरी डिस्ट्रेस विच आर एब्सेंट इन दिस पेशेंट. On circulation assessment, pulse rate was 90 per minute and blood pressure was 174 by 106 mmHg. मतलब patient क्या है, hypertensive है. Sensorium was alert. GCS was 15 by 15 E4 V5 M6. Means I was opening spontaneously. Verbal response was oriented, and on motor response she was obeying the commands. HOPI, patient was apparently all right 10 days back when she developed fever which was intermittent in character and progressive in nature, associated with generalized weakness and body ache. It was relieved on taking medication. She also complained of shortness of breath which was insidious on onset, progressive in nature, and MET score was 4/4. That means she was not able to move to washroom by herself. Patient also complained of burning micturition which was associated with urgency, incontinence after every 3 to 4 hours per day. It was not having any foul smell. It was associated with loose stools which was 6 to 8 in episodes. There is negative history of hematuria, vomiting and pain in abdomen. Past history, she is known case of hypertension since 8 years and she is on tablet, that is tablet Emlong 5 mg and tablet Talmasartan 40 mg. There are no other comorbidities. There is no any other past surgical history. Family history was not significant. Personal history, she is vegetarian by diet. Sleep habits adequate. Bowel habits and bladder habits were abnormal. That means loose stools and burning micturition respectively. There was no addiction of smoking, alcohol, tobacco, etc. General examination, decubitus, patient was lying uncomfortably on the bed due to the hemodialysis catheter insertion. Vitals, she was hypertensive and there was severe parallel. Rest, icterus, clubbing, cyanosis, edema, lymphadenopathy सब एब्सेंट था. बाकी सारे वाइटल्स भी नॉर्मल लिमिट में थे. इन्वेस्टिगेशन पिक्चर शोड सिवियर एनीमिया, थ्रोम्बोसाइटोपिनिया. KFT shows increase in urea. Creat was 10 mg per dl. Uric acid was 7.8, and when we have calculated GFR from Google GFR calculator, it came out to be 4 ml per kg per minute. That means there was stage 5 kidney disease present. LFT picture shows alkaline phosphatase level was increased. ECG picture shows LVH, that means there was SOCO low line criteria, that means there was long R waves and deep S waves. Dengue NS1 antigen IgM IgG was negative. Typhoid IgG IgM was negative. Malaria test was negative. Urine culture and sensitivity showed no growth. ESR was increased, that was 110 mm. So raised ESR, why? Because of anemia and kidney disease. There is one mnemonic to learn why ESR is raised. That mnemonic is napkin. Neoplasia, anemia, pregnancy, kidney disease, inflammation, इन्फेक्शन एंड एनसेफेरसी न्यूप्लाज्म. तो फिर ये सारे के सारे रीज़न होते हैं फॉर रेज ESR. तो यहाँ पे तो दो प्रेजेंट है इस पेशेंट में, किडनी डिजीज और दूसरा एनीमिया. Peripheral blood smear shows microcytic anemia with neutrophilic infiltrates. Iron profile showed iron deficiency anemia because there was decrease in iron, decrease in transferrin, and increase in TIBC. The vitamin B12 levels were in the normal limit. Echo report shows normal LV systolic function, concentric LVH, mild MR, mild TR. HBS AG, HIV 1, 2, HCV was non-reactive. Ultrasound whole abdomen was showing left renal cortical cyst, mild bilateral pleural effusion, increased bilateral cortical and medullary renal echogenicity. Now there is one Cockcroft Gold formula through which we can calculate creatinine clearance. The formula is 140 minus age into body weight divided by serum creatinine into 72 multiplied by 0.85. So that comes out to be 6.16 ml per minute, which shows stage 5 kidney disease. So management which was given to this patient was, because the diagnosis of this patient is acute on chronic kidney disease with anemia and with hypertension. Management is injection monosep for preventing bacterial infection, injection levoflox which was antibiotic, injection Lasix which was diuretic, injection Amlong was given which is for hypertension. Capsule Bifilac was given which was treatment for diarrhea. Syrup Alkasol is given which is treatment for UTI. Injection Amset is given which is treatment for vomiting. Tablet Fibixostat is given which is treatment for hyperuricemia. Tablet Rezod is given to treat GRD, which is proton pump inhibitor. Tablet Shalcal is given, which contains calcium and vitamin D3. Sacket Uprise is given, which is for treating deficiency of vitamin D. Injection Mole is given to treat fever. Injection Perinom is given for vomiting. So I want to tell you before ending this video one ABCDEU concept of CKD. It is just a mnemonic to learn kidney disease thing. ठीक है. A से anemia, B से bone mineral disease, C से cardiac complication, D से diuretic use, E से electrolytes and U से uremic symptoms. All were present in this patient. That means ये पक्का CKD था. And that's all. I hope you have gained some knowledge listening to this case. Dr. Muskaan is signing off now.